Our next discussion is being led by Carol Maher, Professor Carol Maher from Australia, from Adelaide, beautiful town. Come on in. Well, right there. Oh, yeah, excellent. Bring him in. So let me rephrase the question, though. Okay. Do wearable technologies empower users to take control of their mental health or risk over-commercialize wellness?
Thank you, Adol. Okay, so can I welcome up some panelists who very kindly agreed to come up and help us discuss this topic? So we have Jacob Meyer, hopefully I've pronounced your surname correctly, who is going to be one of the presenters tomorrow. And then we have Brendan and Benjamin, who I happen to be sitting with on the table today. And we've had some really amazing conversations about the work they're doing. And I really wanted to shine a light on it. And also, our conversations have touched on wearables. So I thought it would be nice to hear some different voices. Yeah.
Could we make sure that everyone introduce themselves when they?
Sorry. Yeah. So if you could go down the panel and introduce yourself, explain, kind of what work you're doing.
I'm going to let Brendan go first because I can't introduce myself without knowing what he does.
Sure.
My name is Brendan Kelly, and for the past 14 years, I've owned an outpatient mental health counseling practice that has its own fitness center and directly incorporates the use of exercise as a primary treatment modality. And Ben is basically my partner in this program.
That's right. And also, the business has a non-profit arm, and I'm the director of that non-profit because, as you're all aware, access is an issue. So we raise funds to get people into the gym, buy them shoes, get them personal training, and put them through things like that. So that's one part of what we do. My other hat that I wear is I'm a family medicine physician and I'm a faculty member on a residency program. So I teach young physicians who are coming up through the program.
Wow, that's amazing. I want to hang out with you guys.
I know. Exactly.
My name's Jacob Meyer. I'm a faculty member at the University of Wisconsin-Madison. I do research looking at different movement-based interventions to treat depression and other mental health conditions, some incorporating with therapy, which I think we would have some overlap with. But I've also used some like technology-delivered interventions and then also a lot of tracking of behavior through wearable technology. So I think that's why I'm here.
Yes, thank you. Okay, so I thought wearables is something that a lot of people have experience of and opinions of. It would be really great if we could start by getting anyone who has used a wearable activity tracker to stand up. Wow, okay, so probably roughly 85% or something, I'd be guessing. Okay, awesome. And maybe can you sit down if you don't use one anymore? Okay, wow, probably more than half. Okay, interesting. Now I would love this part of the day, we're coming towards the end, to be, nice and interactive. I think there's lots of good voices to be heard here. So is there anyone who sat down who would like to share their experience of why they're not using a wearable anymore? Yeah. Oh, now you've like set the standard, Rebecca.
I actually have my watch on today, so but I didn't for about a year because of Apple not disclosing what forever chemicals are in the watch, in the band. And so I got a stainless steel one just recently. So I'm giving it a try, and then I'm putting it on airplane mode most of the time to try and like keep it a little healthier. Well, what I was reading is that if it's on airplane mode, then it's not constantly connecting to our phone, which is connecting to networks and the EMFs. Just a way of keeping myself a little less connected to technology.
Sure. Thank you. Okay. So, I thought we could start with asking our panelists, what do you see as the greatest promise or the greatest pitfall of wearables?
Um, let's start with the promise. I just think the feedback mechanisms are useful in many, many ways. On an individual level, I know for myself, sort of even the slight gamification of exercise, even just against myself. Like I know I both run and mountain bike with a Garmin, and I love being able to see like how I'm getting faster and how I did last time compared to this time. So that can be a big motivator. I think there's a space somewhere for feedback with healthcare providers. You know, in my case, I'm biased towards medicine, but you know, we tell our patients to exercise and we ask them to. Um, and then we don't know what happens after that. You know, family doctor in America sees someone once a year and for half an hour, and then a year later, hey, how'd the exercise go? So there must be some place where we can close that loop a bit and get some feedback there.
Yeah. Well, can I just ask you, do you know what percentage of Americans actually take advantage of that annual wellness check?
No idea. Actually, that's
Okay.
a good question.
Right.
Yeah, you know, there's 30 million Americans who are uninsured. So
Mhm.
not them. So yeah, it's a good question.
I think I think the benefits of wearables, kind of like as Ben said, on a personal level, I like to, see progress that I've made. I'm getting faster, or whatever. I enjoy that when that happens. It doesn't always happen, obviously, but from a practical level, as somebody that essentially like has a practice that incorporates exercise, like we get our we recommend certain types of exercise to our clients, meaning the goal is 150 minutes of moderate intensity cardiovascular exercise every week. Not all of our clients do that by any means, but being able to say to somebody, okay, here's the heart rate range that you want to be in. You're 50 years old, your max heart rate is, on average 170. You want to be 60 to 80 or 65 to 85% of your maximum heart rate. So when you exercise, you want to, pay attention to your wearable, your tracker that's monitoring your heart rate, and you want to be somewhere between, say, 115 and 140 beats a minute. It gives people kind of like clear, specific, instructions to follow that are very easy. So that's something that I think, I would love if everybody at our practice, had a wearable, because it just kind of makes like knowing what to do when they exercise a whole lot easier.
Yeah, I think I'd echo that in a slightly different way to say that like wearables provide us with data. And I'm like a huge data nerd and I love to see numbers. And if you're one of my graduate students, you would know all I ever ask for is show me the data. Let me see the picture that you've created. Show me the graph. But without that, we don't know where we are. Like if we've never recorded the data, if I asked you how many steps have you taken today, you'd be like, you would either do this and tell me the number, or you would say, I don't know. But if we don't know where we start, it's very hard to figure out how we're going to change or how we're going to improve. So I think if nothing else, wearables give us that like data point that at least at one point in time is very useful. And then hopefully we can track over time and improve or whatever. So I think that from a like, how is this helpful? I think it gives us a tool that we don't, is hard to do on your own. It's hard to estimate how many steps you've taken on your own, but this thing does a really good job. And then I think on the flip side, like what's the biggest challenge or weakness? You asked something like that. I think sometimes we can get too sucked into it. Sometimes you can, to the point where people don't feel like they have the autonomy to do anything because it's telling them, oh shoot, I got to stand up now. I just got to however long I've been sitting. And I think, that the loss of autonomy can happen with especially wearable technology. So I think, everything in moderation is probably the right answer, but it does give us some cool tools we don't have otherwise.
Yeah, awesome. Thank you. Yeah, and I think what you were saying about if it's measurable, it's a lot more powerful. And it reminds me of, I think there's a saying in management of like what can be measured can be managed. Basically it's really hard to change something if you don't have a way of kind of knowing where you're starting and tracking whether, changes you're making are actually making a difference. Now, I think I would love for this to be, for us to take questions from the audience. So if there's, yep. Okay, beautiful. So I've got some questions lined up, but I'm happy for those ones to get bumped.
It's not so much of a question as it is a comment. What we're working with our pre-service teachers, and this is something that's brand new. What we're trying with them initially is we've had them purchase, because we're using it as our classroom textbook, a generic watch that calculates their zones, but it gives them a flashing color to tell them whether or not they're in their zone or, moderate to vigorous intensity. So there's 3 categories. There's the blue, there's the orange or yellow, and then there's red. And so they can see it. And our goal with this was for us as faculty to help them understand what moderate to vigorous looks like for them, because you brought up the component of making sure that they're in the particular heart rate zone. So let's take out all the calculations. Let's just look at this with the watch. And then ultimately what we would like to do, we're only about 6 weeks into this, so this is brand new, but what we would like to do is to be able to have them in turn take it out into their classroom spaces. So our younger students are learning what moderate to vigorous feels like. What does it look like? What does it feel like? And so that they have a way to firstly conceptualize it, but then also look at the data from their watch. And then with these data trackers, we're able to print out reports that showcase, whether they're in this zone or this zone and this zone, and to compare and contrast those to the types of activities that they're doing in the classroom at that time. So ultimately, we're hoping that it's a tool that will be beneficial for our students as teachers to see how can they improve their classroom spaces to make sure that they're incorporating moderate to vigorous physical activity in their PE spaces, but also help children understand as well what this looks like for them.
Awesome. Thank you. Okay. I think we're next up here. Rebecca, I needed to recruit you.
So I'm generally agree with all the benefits that you mentioned, but kind of pitfall that has come up in some of the work that I've done with mental health therapists and their clients is concerns about it's great when you get feedback that says you've improved, but they're concerned about clients who are prone to guilt or shame when they don't improve or don't meet their goals. And a lot of times if you're working with someone maybe with depression who's having trouble meeting really small goals, the Fitbit or whatever can sort of reinforce that they're not achieving what they're supposed to. So I'm curious if others have encountered that or have suggestions about navigating that side.
If I could say something about that. I think it's really important when it comes to, wearing wearables and, specifically for improving our mental health. It really boils down to 2 things, time and intensity, right? How much time did you spend exercising? Somebody said, yeah, you're seeing benefits at 10 to 15 minutes. So 10, 15, 20, 25 minutes, and within that target heart rate zone. Those are really the only 2 things that you really need to be, you really need to track. If you get into, like, okay, how far did you run or how fast did you run? Or are you making progress in terms of getting, running further or faster? That's where the pitfalls can really happen. But if we keep it simple to like just time and intensity, then it kind of simplifies things and it takes a lot of the potential pitfalls away.
Yeah. Now, I might just add to that. So years ago, I think it was maybe 2016, something like that. I think I mentioned in the other presentation that we had done some research looking at how valid consumer wearables were. And around that time, a whole bunch of studies were coming out, and they all kind of said, yeah, they're pretty accurate. But when we'd been doing that study, we'd had the experience that, wow, some of the brands like break, even though they're only a few weeks old. Some of them are really not very user friendly, and the participants were saying to us, I like this one, but I really don't like that one. And, our study wasn't designed to pick that up. And it was, there were all these validation studies coming out but no one was actually reporting on the user experience of wearables, which is obviously super important if people are to, want to keep using it. So we just did a little fun side project where we did a survey of people who were using wearables or who had abandoned their wearables. And as part of that, we did do, we looked a bit at the psychology of it. So, and did basically trying to explore, does it empower users or does it make them feel more anxious? And because, there's quite a lot in the media about how wearables can make people feel bad about what they're doing. And we actually found, based on that survey, it was really uncommon for wearables to make people feel bad. By far, it was positive. And most people, if they didn't like it, they just like stopped using it, or they could kind of reconcile it themselves of, well, I didn't because I was sick or I was busy or whatever, So it's, the message that we got from that was, it seems like the negative impacts probably get a bit overemphasized in the media. The media love a bad news story. And it's funny because, of all my research, that's the study that keeps coming back. And I get contacted by the media, every year or so to, comment on that question of whether wearables, are harmful. Because I guess it's, bad news sells.
Really appreciate that question. Just to add one more thing, I think you're talking about a very special case of people with guilt and shame issues, and that's not what the media was focusing on. That we're talking about a small group of people. I think it's actually super important. You've got the wheels turning for me. I'm going to talk to Brendan about it this week coming. I think there is a solution to that. The individual therapist with their client talking about that data that the wearables collecting together and making sure it's presented in a way of either positive or, let's work on in this therapy session what happened that was your barrier to taking away the guilt and shame. I know my Garmin 1 to 2 kilometers into each run, it gives me a performance condition, and every now and then it's -1 or -2, and it makes me really mad. So thank you for raising that question. It's really good.
Yeah, can I just share my experience with Wearable? I own probably the first Garmin machine that ever came out. I remember the size of it was 5 or 6 times the size of this Apple Watch. It was huge. And one of the biggest concern I had, now I have panic disorders, and I stand up and talk, and my heart is just beating so fast, and I actually can feel it. And I decided as that I started doing my training and running that I want to monitor how I'm reacting to stress. So I was trying to figure out, is my heart rate, slower now that I am more fit and I'm exercising regularly? And I noticed that it did. I noticed 3 things happening. Number 1, my resting heart rate was down. My response to stress is down. Like when I'm in an argument or discussion or giving a talk, my heart rate isn't kicking as high. And then my recovery from my run is actually going faster. So I'm able to get down to it. So how much of this type of monitoring and this type of training that you feel as a therapist would be helpful in engaging people in the use of Wearable, where they could be their own self monitor of how they are reacting to stressful situations?
Yeah, particularly people with panic disorder, exercise is a great form of treatment for it because it can kind of habituate people to a phenomenon that, initially is very scary. They notice their heart rate increasing, and then the anxiety kind of sets in as a result. They, start to, why is my heart rate, why is it getting so high? What's going on? And then the panic can start. So if a person starts to exercise regularly and then experience this raised heart rate as a result, it really kind of normalizes this phenomenon, instead of it becoming very scary. So that, and then along with just the overall benefits of exercise on, helping people feel more calm and relaxed and less stressed out, helps with that as well. So I'm not sure if I answered your question correct.
I just think that I think expressing the way they are dealing with stress by their heart rate, in addition to how they're feeling, is a good way of allowing them to couple the two. You know what? I'm doing better because look at my heart rate, despite the fact that I'm standing up here speaking instead of, 100 people, is not as it was before that. I was just thinking about a tool that therapists like yourself could actually bring on to the patient to engage them in the use of wearable as a way to monitor not only their heart, but how their emotions are reacting. Make sense?
Yeah, it does.
Yeah, yeah.
Thank you.
And I do have a question for you. I loved your triangular chart, Carol. I love it. It's been on my mind for years. Is how we integrate physical activity and emotions. How do we get the emotions and motions work together? How far are we from coming up with an app that actually make this a reality? I know in your work you talked about, several apps that, but it doesn't sound like they're yet in that position where I'm anxious and this is what I'm going to do to control my anxiety. And I just did it. And now I just don't know how you envision that kind of app and how close are we to really coming up with some sort of a reality concept of it.
I think the power is in our hands, to be honest, because we have all the pieces there. So, and I think we've got examples of, services where exercise is being integrated into, psychological care. So I think the challenge is getting that into the healthcare system at scale, which I know you guys are starting to think about, which is amazing because it sounds like your service is terrific at a local level, and yet you're not aware of other services that are similar, happening across the country, across the world. So that's kind of the challenge, isn't it? I think like we need to get better appreciation of the role of exercise in management of mental health because we can create the tools. I don't think it's not really a technical challenge. It's more about the point of integration. We need the healthcare system to fully value the role of exercise in treatment of mental health conditions. And, and then from there, it's just a matter of, putting our thinking caps on and actually working out, well, what is the tool that we need to create to help deliver that? Yeah. Yeah. I think the technology, all the potential is there, but it's having a health system that is ready to embrace it, I believe. Is there anyone else that wants to add to that?
I don't know if I can add to it. I have not even sure exactly how to ask the question. It occurs to me that we're a kind of a weird group here in the sense that we are all data nerds. And so getting feedback is really important to us. I would also say that I observe that getting feedback is often more important to my male clients than my female clients. And many of the software developers happen to be male. So we get these kinds of competitive apps that are developed. I'm wondering if we're missing the opportunity for a different kind of an app that would be available to people who don't feel like they need to know all of the little details, but still can benefit from the feedback. And so I don't know if there's anything being done in that area.
Yeah. Yeah, I guess the co-design approach is helping kind of address that exact problem. And say the digital health coach that I very briefly showed today, we had an initial startup day-long meeting with our software developers, and they had come to that meeting with, screenshots of, all things like Apple Health and Fitbit app and so on. And they were, all kind of geared up to go down that path. And but we said we're committed to a co-design process here. So we, assembled a panel of, end users. This is like people with disability and chronic disease, and people on disability pensions, and a really diverse, but high health need group. And thankfully, the software developers actually came to the co-design workshops, and it really opened their eyes to the fact that all the stuff that they had been thinking about was not what users wanted. It wasn't at all what the users wanted, and yeah. So, I think co-design, which, has a huge amount of momentum behind it, will very much help with that. Certainly for programs that are being developed by academics, maybe less so in the commercial world, which is much more about a bunch of young tech heads getting together and creating a product that they think there's a market for. Yeah. How are we for time? A couple more. There was a question over here.
Hello, I'm a physical therapist, and I wanted to talk back about the pros and cons that maybe I've come across. And one of them is accessibility for some of our patients that are maybe can't afford wearables, or it doesn't function with a wheelchair user. And that's something that I would love to see more research on so that can use them. And I think it's a great way for us to measure capacity versus performance and participation. Like, I have a patient who tells me, I'm so active, I'm doing great. And then I notice that he's wearing a watch, says he always has it on. Let's go look at your data. He's actually only doing 400 steps a day. So it's like a great education piece. And then I didn't know I can do this. And it was a great way to get more activity for him. And he was like on it then afterwards. So just wanted to, if anyone knows about a great wearable for wheelchairs, would be amazing. I know in research there is some. Garmin, I think, has a wheelchair piece, but I think it's more like heart rate in general. But yeah.
Oh, thank you. I mean, what a great example of where the limitation of self-report. Yeah, because obviously people who don't move much, when they do move, it feels, it involves a lot more exertion. And so they can actually, subjectively feel like they're being quite active. Yeah. I mean, I could talk to it, but I would love other people to. You'd like to add something?
Thank you. I think when you mentioned the user experience and getting information from the user, I think it would also address your issue that you mentioned about the challenge with clients, some of them. And I think sometimes it's also our own ego when we get invested so much into something and it's already out, backtracking. But overall, I think that I really resonate with that we really need to not just get the user experience, but also diversity of the user experience and the environment we are going to implement this in to make sure those folks have their voices heard. The wheelchair example is a good one too.
Just as I walk back up. So if people use a manual wheelchair, the wrist-worn ones aren't too bad because they will be wheeling. But if it's a power wheelchair, a wearable is going to be not particularly helpful. Yeah, that's a real limitation. Just like wearables generally not great for cycling. It's based on movement. So, it's based on an accelerometer in the device capturing movement. So, an accelerometer based measure is probably not going to be particularly helpful for a wheelchair user.
I have a question, and it's for all of those of you who actually do use wearables. Why do they use it? Why do you use it? I mean, I know why I use it, and probably I tell you, I use it in the early stages because I wanted to know my heart rate and I wanted to know how many miles I run in a day or whatever, in a week, in a month, and but now I don't even look at it. I just go day after day after day, and then once in a great while I say, "Oh, in fact, I just did that right now to see how what I've done last month." So, is it just a fad? Is this something that we're just using because it's there, it's available, it's becoming less expensive, or are we really benefiting from it on the daily basis of our life? I don't know. I don't have the answer to that, but I think if you really do a survey, I bet you a large percentage of people who use Wearable today use it because it's already embedded in their watch or it's already embedded in their phone, but there's really no specific goal. I had a goal when I first started using it, but my goals just keep coming less and less. And now I don't really, because I know I run and don't have to do anything. A lot of time now I'm just turn it off because I'm annoyed by all the buzzing that it does when I'm running. So I'm really looking forward to the days where we have a wearable, an app that not only measure our physical activity, but our emotional activity of how we feel and how, I honestly, every day, I'm fortunate to have a supportive partner and wife. And I get up in the morning, I feel good about my day. I go to work, I have challenges, but at the end of the day, my emotions kind of a key. I mean, they go up and down, but they don't go like this, But it would be great to have a way to measure that on the time when things are really going wacko on me and say, Adel, you need to kick up the running game. Okay, now you need to spend more time, doing things other than just, reading the news or, So I don't know if we're close to that. I don't know where we are in that, but I would love to be able to have an app of which every so often I'll just say, I feel like shit today, or I feel. Anyway, I'm sorry. I didn't want to make a long story here, but this is what is it called? How we feel. Okay, is it linked to a physical activity app? You can. Okay. So if things are bad, you kick up your running game or you do something to get outside and go out for a hike, and then maybe the next day you feel a little bit better and you can gauge that. Well, I think that I'm glad. Yes, yes, yes. That is absolutely what we have there.
Adel,
Go
just
ahead.
there is active research from the Department of Defense and a couple of other places that are trying to use passive sensors to be able to predict someone's mental state, in particular for people who might be in maybe like emergency services or in like active military environment, such that you could be able to say this person has the energy and capacity to make a good decision. This person's current physiological state is such that they're unlikely to make a decision that will, be positive. That research is actively going on. There's a ton of money in it. I don't think it's very good yet, though.
Wow.
So,
That's incredible.
It's like it's worn in multiple sites on the body.
Yep.
And the sensors cost $2,000 each. And yeah, each person's wearing multiple. But yeah, I think they're using it quite a lot in military, and they want to get it into healthcare.
The garment arousal. I'm not familiar with that.
I think it's mostly heart rate variability based, but I don't know the data underneath it.
Yeah.
I know Apple sometimes
All right.
tells me it might be time to take some deep breaths.
Yes, that's good.
And I don't know if it's just random or based on something.
And then my time clock tells me that we need to close the session. I want to thank Carol and thank Benjamin and Brendan and Jacob, and I really appreciate that. And I want to remind you that at 7 p.m. Dr. Peter Gray is going to be speaking. So we will be gathering right here in this room. There'll be some snacks and healthy stuff out there for you. And I look forward to seeing all of you there. I want to thank all of you for being part of our journey today. I want to thank all the wonderful speakers and the panelists. And I can't tell you how pleased I am with where we are today. I thank you all. And I look forward to seeing you in a little bit. And then remember, tomorrow we will meet here again. The session starts at 9 o'clock in the morning. There will be a delicious breakfast sitting out there waiting for you. I will be cooking all night. I won't take credit for the bacons because they're really good. All right. Thanks so much, and we'll see you soon.